But what I see is that folks have done quite a bit of research on the strategies of care management, have had ideas of how to bring that to their local markets and adapt it to the healthcare systems. And now I see them in the process of finalizing their strategies and actually executing. In the U.S. market, many of the payers were eager to adopt care management services first as a risk mitigation strategy against high dollar claims and severe illness and acute illness in the 80s and into the early 90s. And then in the mid-90s adopted a chronic care focus into that, and then adapted that further into consumerism in the early 2000s. What's different working outside the United States is most of the U.S. carriers, even the larger ones, only have a small percentage of a general practitioner's practice that they're involved in, that many of their members or patients, if you will, are scattered throughout many practices and commingled with other health service providers or other plans. When you work internationally, be it in France or the UK with the primary care trusts, you are working then with an integrated system, even if you're not fully integrated within that system. So you're working on the whole panel, and therefore it gives you a better opportunity to work not only with the consumer, which is where care management has been predominantly focused in the U.S., but also collaboratively with the provider at the same time. I think you'll see the models outside the U.S. Being much more holistic in that fashion. Sure. If you think about the single payer system, it allows the payer to holistically work with the healthcare system in a unified single strategy. And what I mean by that is, in a multi-payer system, you'll have multiple payers rolling out their strategy for quality improvement and communication with providers and consumers. In a single payer, and those strategies sometimes will be confusing, at odds, or competitive with one another. In a single payer system, there's an opportunity to come in with a concise, clear, single focus strategy and begin to build on that year after year with the providers, with the consumers, with regulation in the health system, and begin to make a planned, thoughtful investment towards a goal over time. It's more onerous from one regard because you have to generally be at a bigger scale quicker. So that is the converse challenge to working in a multi-payer system. But I think that if you look at care management as a holistic strategy, one of many that a health system service or will use, I think they have a chance to integrate it in a different way in a single payer system.
So you were acquired by Bupa in 2008.
That's correct.
How has that influenced?
It's been a fantastic transition for the company. You can imagine as being part of a £10 billion worldwide healthcare organization that is mission-based, and Health Dialog having its roots in the mission of health improvement. Bupa has really created the platform for Health Dialog to go international, and in particular we've had strong growth in Spain and Australia and in the UK, where Bupa already had substantial businesses.